All right. I want to welcome everybody to week 5 of our regional report out calls, January 12th, and this is the southeast region of Kansas. We'll be here every week at 4:30, or every week at Tuesday at 4:30. To give this, I encourage you to sign up for the email at covid.ks.gov/report-outs. That's covid.ks.gov/report-outs. And you'll get some of the stuff that we'll talk about with the vaccine today, the dashboard that we go over, and links to some of the websites that we look at. So got the All-Star Southeast team here today, including a special guest who's going to lead us off. He's been running the marathon with me today. Seth Conkle is no stranger to the regional report out calls. He's been on the South Central call from the beginning and just recently got appointed as the special advisor to the governor on the vaccine rollout. So he's taken on a big leadership role. We're all grateful for that. Leadership roles these days are pretty thankless, but it's a big one and an important one, which is to get this vaccine out across Kansas. And so the governor rolled out her strategy this week process, and Seth's going to give us kind of a baseline for that so that we can give updates on that on future calls as well. So Seth, you're the presenter. Take it away, my friend.
All right. Thanks, John. Well, yeah, I'm working out of the governor's office with her and her staff, along with KDHE and other state partners to make sure that we get the vaccine to Kansas to get them vaccinated. Before we jump into the plan, I do want to go over a couple of definitions that I think are coming up or may come up in the next 6 months. So the first one is the thought of allocation. So this is simply the process for determining how much vaccine a specific provider gets. This happens from the federal level to the state, from the state to the locals, and could even happen within the local level as well. There is no vaccine moved during this allocation period. That comes in our next phase, which is distribution. So after those allocations are done, we know where the vaccine is going. That's when they start shipping out from the various warehouses, and then they're received at the local level. Once they're received at the local level, we come to the final phase of kind of this circle, and that is the dispensing. So that's actually getting the shots into the arms. You may be seeing it reported out as doses administered, vaccine administered. And from the time that this starts, so when we receive how much we can order, so to speak, at the state level, to the time that it's actually administered and that administration paperwork is into a state system, we could be looking at anywhere from 7 to 10 or 11 or even longer. So that's part of why we're seeing some data delays. I think a couple of weeks ago, the state got beat up for being at the bottom of the vaccine administration numbers. But since then, we've risen to the middle of the pack and continuing to go up. And now are in the top couple of tiers of states across the country for actually getting doses administered. So thank you to all of those out there that are taking on that role and responsibility to get that done. And then finally, I think the last thing that you may start hearing more of is the concept of a pod or a point of dispensing. This is simply the location that you go to receive your vaccine. It's more used in public health and more used around the concept of mass vaccinations, to where they have a lot of vaccinators, a lot of vaccine, and they're running people through very quickly, as opposed to that one-on-one appointment that you may receive when you go to see your primary care physician. So those are just some definitions that I think will help understand some of the things that we're going to jump into here as we talk about the plan that was rolled out last week. Part of that plan was the new website, which is kansasvaccine.gov. Again, kansasvaccine.gov will be the one-stop shop for all of your vaccine or your COVID vaccine questions when it comes to the state of Kansas. So on this website here, you can see over 84,000 doses administered as of yesterday. Again, we know that there's still some data delays. This may not include everybody that actually received a vaccine yesterday, because again, some of those data delays mean that they have to get that entered into the state immunization database, which is called WebIZ. but that ultimately would conclude that first dose for that individual. On the website, you'll see some safety and information about how safe the vaccine is. You're going to see some FAQs, just frequently asked questions that we're seeing on a regular basis, or maybe coming from the local levels, and then just distinguishing between fact and fiction. Again, just trying to dispel some of those rumors that may be out there. But I know that what most people want to know at this point is, where do I fall on this list? When will I get it? And then where can I get it? So if you use this availability tab, click on it. It's going to take you to a new page. A lot of information here just on the page itself, but you're looking for really two key things. The vaccine phase by population. I'm going to click on that. And that ultimately brings me to this tab where you have a one-page high-level overview. Currently, Kansas is serving everybody in phase 1. You can see the kind of category, so to speak, and the rest of the phases of 2 through 5. And then down here at the bottom, you will see where we are at and when we think we'll be able to move into the next phase. So as we look to phase 2, we're going to be able to vaccinate everybody 65 or older, those in congregate settings, and then high contact critical workers. So again, it's hard to tell, do I fit into one of these? So this is where you need that second document that I talked about that's out on the availability page. So for a little bit more detailed definition of each of those sections of each of the phases, you want to come down here to the vaccine prioritization plan. When you click on that, it's going to bring up a 10-page document. And I don't want to spend a ton more of your time today. So I'm going to focus on the high contact critical workers that we're going to start seeing in phase 2. Obviously, 65 and older is easy to define. High contact critical workers is not as easy. So we've provided a definition. This definition is the most important piece of information on all of these pages. So keep that in mind as you're looking through here. This is what you need to be focusing on as an individual. The description kind of gives you some background and some knowledge around how the definition or where the different definition might have come from, and then some of examples of groups. So again, these examples are just that. They're examples. They are not all inclusive. So if you identify with a group that does not get listed here, it doesn't mean that you don't fit into this definition. It just means we had too many groups to list. I'm going to pick on our retail workers real quick. So let's say you work for a retail company, you are the accountant, and they've said, "Hey, with COVID, we don't need you in the retail space. Go home, do your work from home." That takes you out of this because you're not coming into close contact with large numbers of individuals. Again, you have to look at the definition, not just the group. So the last piece I'll share is that if you don't fit into this definition, keep going down until you find the definition that best suits you as an individual or your loved ones. And that's the phase that you're going to be in. And that's when we'll have enough vaccine available to be able to schedule you for an actual vaccine or an appointment. There is plenty of vaccine that will be available for everybody that wants one to get their first and their second dose in time. And that doesn't mean that it's going to happen next week for everybody. We are, continue to be on a more of a marathon pace than a sprint pace. And I think with that in mind, John, we look forward to being able to be back to help share more information as it becomes available or as things change. And we appreciate the work that you and the entire group are doing.
There we go. Thank you, Seth. We appreciate it. So while we got Seth with us, it's a great rundown of the plan. Does anybody have questions for him while he's here on this call that you think might be helpful to you or the Southeast region? Yeah, so good. You cover it all.
Perfect.
Thank you, Seth. We appreciate all you're doing for the state and that you take time to be on these calls. We wish you well, man.
Absolutely. Same to you guys. We appreciate all your work. Have a good rest of your call.
Thank you very much.
Bye.
All right. I'm going to now kick it into what's our regular rhythm. So I'll go to our dashboard here real quick. All right. Not a great story out of Southeast Kansas. It could be worse. But let me look at the numbers as compared to last week, just to give you guys a frame of reference. So when we look at, part of the good news is we are seeing less staffing issues across the state. There are still some, but it's not as bad a pinch point as it has been. So that's positive. When we come down to confirmed hospitalizations of COVID or suspected COVID patients, that's at 55. Last week, that number was at 50. And then ICU beds with COVID patients. Sorry, I was looking at the wrong list. Sorry, that was at 51 last week. This week's at 55. This number was at 18 last week, has dropped to 13, which is good. And you see it here with adult staffed ICU beds available. We've moved from 7 last week to 13 this week, which is from 22% to 41%. So that's good to see. Though, we're not loving what we're seeing down here, which we thought maybe we had seen a peak back in here and we were starting to come down, but the numbers have come right back up to where they were. So at best, we're at a plateau, hopefully not on a new ramp up. Real important to look at. Southeast Kansas was at a 12.8% positivity rate on its testing by the KDHE test this past week. 12.8%. So also that's concerning. Here on the second page, you can see the census of the COVID ICU bed, or the ICU beds with COVID and non-COVID, and what's available. And then here in Southeast Kansas, how many people have tested positive according to the population in each county here. So this tells a story, one story. With numbers, but let's come to our real storytellers, the people that are living it every day. And let's go to Destiny Wheeler first to give us a public health perspective on how things are going. Destiny.
Hi, everybody. I am Destiny Wheeler. I'm the Wilson County Health Department Administrator. I want to say that I think having Seth on here was great. I really liked that he pointed out those definitions that we use in public health more. We've been using them for quite some time, and we tend to forget that they are our own kind of lingo. So I'm glad that he pointed that out. We are working to get vaccine distributed dispensed as it comes in. It's a little bit different than a typical pod that we would plan. We generally use flu pandemic in our training and exercising. And this particular vaccine, you have to give it within a certain amount of time after you puncture the vial the first time. So a typical drive-through situation or walk-through situation, it doesn't work that way with this vaccine. So as public health, we're working with our hospital partners and our other community partners to try and get cohorts, either of 5 or 10, whichever vaccine we're giving, that's how many doses are in a vial. We are working with those partners to get those groups together so we can schedule those appointments. And then folks have to wait about 15 minutes after we give it, which is also not typical with the flu vaccine. So there's a few more steps in the planning, but once we find out our allocations, we're really working hard to get them out quickly. So it seems to be going pretty well. A lot of it's kind of a hurry up and do it, and then we wait, and then we hurry up and do it, and then we wait again. So I think that's going to be the way that it is for a while. As Seth mentioned, we are combing through the prioritization document with a fine-tooth comb right now. We're getting a lot of calls, people wanting to know when they're going to get it, which priority group they're in, and a lot of that is up for interpretation of the document. And we are working our way through that and working with the state and our regional partners to keep that continuity that we've kind of been striving for this whole time. So that's basically where we're at right now.
Yeah, I think an important thing for people to understand. So governor laid out the phases, and I think the governor or KDHE will talk about moving from phase 1 to phase 2. But once it gets into phase 2, as far as the prioritization and rollout, that is really given to the public health leadership in the counties to administer that. And so you really encourage people to be paying attention to folks like Destiny and her colleagues around the region to know, when and where and how to get it. The hard part she did mention was, when are we getting vaccine and how's it coming? This is a work in progress, amazing as it is when you consider its scale, that we've already vaccinated over 3 million Americans. But we all know it's a race against time. And so real important. And I know the state's pushing it out as fast as they get. I think they've gotten roughly half of what they had been promised in December, which I know is hard on everybody who's wanting to get out to different populations. So, help keep the morale up of these great public health workers like Destiny and others, because they're going to be planning and getting this vaccination rolled out as fast as really humanly possible, as fast as they can organize it. So thank you very much, Destiny. And with those questions, just real quick, we did get an email from the mayor of the city of Columbus today, Grant Spieth. He had a series of questions around the vaccine. Grant, what I'd tell you is go through that website. And I was reading through these here just now. Someone had gotten in front of me, and some really good questions. I think a lot of these are tackled on that website and with Seth's presentation, but would be happy to talk to you. And then if there's more, we can address some of these on next week's call. So you can always reach us via email at ksregionalreport@gmail.com, ksregionalreport@gmail.com, and we can take questions. We'll be obviously focusing a part of our time on vaccines, probably on testing a little bit next week as we continue to move through this. So let me pass it over to our hospital friends. I'll start with Bruce. Give us an update on what's going on from that angle.
Sure. Thanks, John. And appreciate Seth's update today. So just kind of adding on to Seth's report, Ascension Via Christi has administered over 6,000 doses of the vaccine to date. Now, that includes associates who are now going through getting their second shots. So I think we've probably vaccinated over 4,000 to 4,500 of our associates to date. We have about 8,500 or so statewide. So we're making good progress. I think that process is going well. So I really just wanted to update you on that. And then now kind of turn it over to Drew Talbot. Drew was our interim hospital president in Pittsburgh, and we've removed the interim title, and Drew is now our hospital president going forward. We're excited about that. He does a great job for us in Pittsburgh. So Drew, if you want to give us kind of an update on what you're seeing at the hospital, it'd be great.
Bruce, thank you, John. I think I'll start with the phase 1 vaccine program here. I thought it was interesting while Seth was talking, as he was talking about allocation. Our initial allocation was 440 doses. We dispensed 435. So whoever did that calculation got it pretty right. And yet at the same time, I was kind of disappointed that our vaccine acceptance rate was really only just a little over 60%, maybe as high as 64%. So anyway, we are halfway through the second dose administration, or that booster dose administration. We're scheduled to run through the first week in February to get everybody caught up. We did kind of a final call, and what we noticed is we gathered another 10, 11% of our associates just based upon seeing the experience of those who were the early adopters. So that was a really good ask to try to get those folks vaccinated who are on the front line. John talked a little bit about where we are in Southeast Kansas relative to COVID, and Destiny and I were talking about that before the call began. As we see this rise occurring, our tested positivity rate, John, is quite a bit higher that we're seeing in Crawford County today than you reported. And it's kind of a frightening difference, so I won't report it. We may need to validate our numbers here.
My data is lagging, for the past week, so I think it's important to hear what's going on.
Well, it's about 30 percentage points different. So we're really getting hammered down here. Today we have a patient census of 45. 22 of those are COVID positive. The interesting thing about this is, as far as ICU and ventilated patients, we only have 5. And so one of the things that I pointed out the last time that I reported is the success of the BAM clinic, the monoclonal antibody clinics. We have seen our allocation increased here, but we're using every dose, and we really feel like that it is lowering the number of hospitalizations and certainly lowering the number of patients that become critically ill and wind up in the ICU and on a ventilator. So kudos to the statewide success around the allocation of BAM. I was on a call earlier today with Secretary Norman, and he was talking about how successful the state of Kansas has been in getting on board with the monoclonal antibody clinic. So, to our region, to the rest of the state, doing some really good work there. As far as I've been receiving a lot of questions, and it sounds to me like Destiny's getting those as well, about our plan for phase 2 rollout. And so I can tell you today that our county health department is planning to take the lead on that. They're developing plans. I've been told that the local FQHC plans on playing a prominent role in that rollout. But again, the plans are hindered based upon knowing the date and the quantity of allocation. So there's just a lot of unknowns for people to do absolute planning. And in the case of venues and what you need for supplemental support, just kind of too many unknowns to go any deeper in the planning. I can say with regard to the hospital, we will probably offer some supplemental support, but we'll stay focused on managing our acute care population and whether or not we receive vaccine to manage through our patient populations as they either come in our clinics or into our hospital. So again, another unknown. And I think that sort of wraps up all that I have to report. Certainly would entertain any questions.
Well, does anybody have comments? Drew, that was really good. And were you, I just want to be clear, were you saying the positivity rate was about 30% higher is what you're seeing?
Yeah, what we're of those tested, what we're seeing is about a 40% positivity rate. And I can remember reporting a couple of weeks ago a number in the 30s. So I don't know how to balance that against your entire regional number.
And I should know this as a region, but does Pittsburgh State have their students back on campus this week, or is it next week?
I believe they're back on campus, but I'm not sure of that.
I know it's right about
I tell you, we've been busy enough at the hospital that I'm a little out of touch with what's going on at the gas station across the street.
Well, we appreciate it. I'm pulling up the up-to-date numbers that we get from KDHE real quick so that I can give those to everybody before we get off this call. Let's see here, percent positive for South. So far this week, yeah, you're right. So as a region, highest in the state right now so far this week. Now it's only 111 PCR tests, but we're at 23.4% positive.
So that sort of squares with us being slightly higher with the student population. I can get to that number.
Yeah. Well, that's the regional number. So I don't have the individual county, but Crawford may be pulling that whole number up if it's what you're seeing. So, look. Apparently
everybody had a really good New Year's.
Yeah, I'll tell you. A little too many kisses at the bell. Yeah, I think, it's been important because we discussed morale last week and, I brought that up to the State Finance Council. It's still very real out there. We heard from a nurse in Winfield just talking about giving, of herself to emotionally invest in helping patients rally and try and rally, and then you lose them and they get wheeled out the door and another one comes in and you got to get yourself back up again. And the wear on that over time is very real. And I think we heard on this call last week, just the thought about it being really combat fatigue. And that was from a combat veteran. And so I'll reiterate, I think it's been an important point's been made that I guess two thoughts. One, now's the time to double down and showing gratitude to our healthcare workers and public health workers, right? They've been at it for a long time. We're all fatigued. Imagine how tired they are. And it is the perfect time to bring grace and love and light and kindness into the world, into our communities. And that's a great place to focus that energy. And second is, we're getting close to the proverbial finish line, and people are wanting to give up now. And it's just a perfect time to find resolve to say, hey, we can do this. We can get to the finish line. And it is, legitimately just a race, especially here in Southeast Kansas, to get that vaccine out as fast as the feds and Pfizer and Moderna can get us the doses to, get those in arms, before we see some things going on in Southeast Kansas that we don't want to see. And as it relates to the major metros, the ICU beds are still at a premium. They're manageable right now in Kansas City and Wichita and Topeka. But we've found some breathing room. But I think everybody still understands just how tenuous things could be if we do get another spike on top of where we are. So, just want to encourage you all, appreciate what you're doing. I have a bright spot. I don't know if you guys had a bright spot from your region you want to share. This is about someone who grew up in the region. It came out of the Wichita News, but they vaccinated a gal here, 101 years old, being broadcast out here on the internet, but Virginia Garber right here, a good looking lady, 101 years old, got the vaccine this week. Now, great thing about her, several great things about her, but she was she'd gotten polio as a toddler, and obviously saw the importance of that vaccine. She said, hey, I'm not reluctant at all, and I don't think the government would release the vaccine if it weren't safe. And just standing up there talking about how happy everybody was. They wanted to dance. Don't need any hips thrown out of place. So, but here you go. She reared 6 children in Severy and was a registered nurse in Greenwood County Hospital. So she's right out of here, out of the Southeast region. And I just thought that was great, seeing this vaccine get out and into the arms of the people who really need it first. And just a great story there about her right outside of Kansas. And what you talked about, the I'm going to say it wrong, monoclonal
antibody. Uh-huh.
Yeah, the antibodies. We're attracting national attention for how well that's going in Kansas. They highlighted Hutch, but what you're doing there in Pittsburgh too, really important, and has attracted the attention of some of our national leaders around that, with how well we're using it and how effectively. So great work on that, Drew. And also congratulations on no longer being interim, but being the full-fledged for the long haul.
Appreciate that. Appreciate you sharing the story.
Yeah, that's great. Well, thank you everybody for being on here. Anybody else have anything before we wrap up? All right, 4:30 every Tuesday, Southeast Kansas. Feel free to sign up for the email, and we'll keep you abreast on what's going on with COVID, with the vaccine, as we try and get through this as Kansans and as Southeast Kansas. So thank you everybody for being on here. Appreciate all that you do.
Thank you.